Good afternoon, ladies and gentlemen. I am Ernesto Hernandez Otero. I am a young leader from El Salvador, and we are at the SDG studio at the EDD 2018. We are here with Taavi Erkkola, Senior Advisor from the UNAIDS. Hi, how are you?
Fine, thanks.
You can take the mic. Okay, so we're here because we wanted you to share with us some of your experience in this field. And the first question is, what kind of data can you share with us about the advocacy about women's rights?
UNAIDS has really focused on access to services. The way we portray the information on women and their rights is sort of twofold. It's about how well are women able to, and women and young girls able to access services that are important for their health. And secondly, what are the kinds of rights that have been set up in each country to ensure that they will have access to it. And this information could be related to age of consent or issues like access to testing for HIV and so on.
Okay, that's very interesting. Okay, we want you to show us the health situation room that you have explained to us. What it is, where does it exist already, and what can you do it? Because apparently it's such a big deal and we want to know more.
The health situation room is really an approach on allowing access for different constituents across countries to view data that is important for people to access the services in terms of health. And that's the approach we have taken in countries where they have a wealth of health data already, but they are not sharing it in a way that would be effectively usable for people at different levels, whether you're working in a district, a health facility, or at the central level. So we'd like to offer this optional platform that allows you to view data in a way that is more actionable. And I'm showing a few clips here of snippets of that information in the slides. And this one, that is the first one, looks at the test and treat approach. And this information is focused on how policy has changed people's access to services. And this graphic illustrates the fact that when policy was changed to test and treat, which means that people who were early on, there was a threshold on who were enabled to access treatment. Now, whoever is testing positive is encouraged to go on treatment for HIV. That change is illustrated between the years 2016 and 17, when in 17, test and treat came into force. So that gap of people who were tested positive and initiated treatment is diminishing. And that's a good thing, because the more people who have HIV and are on treatment, it means that they are less likely to transmit that virus to their partners. Which means that if we're aiming to reduce new infections to a level that by 2030 we can say that that's the end of AIDS as a public health threat, we need to allow the government officials and the different partners in countries to monitor progress towards that. The sooner we reduce that number of people who are missing out on treatment, the sooner we can reduce that number, the sooner we can reduce an AIDS-free generation, which means especially looking at young women who may not know their status, as well as men, of course, but specifically we need to ensure that women have the right and access to those services and can protect themselves from new infections, or to ensure that they stay without HIV infection, or if they're HIV infected, to ensure that they have access to treatment, which means that they prolong their lives, improve their health, and they are also reducing the likelihood of that virus being infecting other people.
Perfect, thank you very much. We will also want to know what are your thoughts about a topic. So, what do you think about innovative solutions to speed up progress in preventing violence against women and HIV infection, and ensuring those living with HIV get the treatment they need, as you just said?
There are many ways to engage communities, which is because we can always talk about the policy level, which is good. And I was referring to the example of age of consent, which means that people need to have the right to go for the services they may feel they need. But the other thing is that how do you make those services better available and better quality at the context you're in? And that you can do by engaging communities and the service providers within, which includes community health workers, enrolling community health workers to locations where not all the services may not be so easily accessible to people, and also collecting information from those communities, which is looking at the kinds of data and the barriers to access services. That's important for women overall in our understanding on, because there are many setups where we may not exactly know what are the barriers, but once they're brought into daylight, they will help us access or act on those barriers a lot better. One thing that is influencing the way we're able to act on those is the lack of data too. And that's a challenge, especially when women are not, we don't disaggregate between men and women oftentimes when that data is being collected in the national health information systems. And that's something that is important to address in the coming months and years. Without that information, we're unable to see where there may be a difference in the way men and women can access the services. So that's one of the priorities for the months and years to come.
So it's necessary to collect this information to know what's the current situation, right?
And how men and women may also feel differently in terms of their ability to use the services that are out there.
Very well. Can we know what concrete action have you taken or experienced in your life to combat VAWG and contribute to the achievements of the SDGs, and that was especially successful?
One of the things that we've observed is the engaging high-level politicians into the SDGs, and I'm using a practical example where we were implementing the Situation Room in Kenya, and the president of Kenya was looking at the number of women who are delivering in facilities, and he was the one who called upon free delivery in every facility for women in Kenya. And what it resulted into is doubling the numbers of women who are delivering in a healthcare facility. What it did was that once they get into the facility, women are also tested for HIV, and that helped significantly reduce the mother-to-child transmission, which reduced dramatically the new infections among children in Kenya. And we are seeing this same effect across countries now, and we're trying to advocate through the implementation of the Situation Room to ensure that that happens. Similar type of progress can be made elsewhere too.
Thank you very much for the example. We're really thankful for you, Taavi. And we are going to end the interview right now. So thank you very much. And we keep going with the EDD.
Thank you very much.